Hello, beauty therapists. How are you all today? I wanted to talk about my thoughts on the skincare industry and what I believe is a possibility in the future. Now, these are just my own thoughts and my own speculations on the industry, but I thought you might find it interesting and you might like to understand where my thinking is around this. So I think this is a really important discussion, not only for job security perhaps, and thinking about the industry and what we have created already, but it's a really good speaking and topic point for actually increasing your professionalism and your standards of work, and really checking yourself and what you're doing to provide services for clients essentially in the skin industry. So give me a little bit while I kind of unwrap my thoughts around this, but I need to kind of go back a little bit to explain my thinking around this. Now, this is solely my own opinion, and perhaps this might not be the future, but irregardless, let's just chat about it. So essentially, right now in the industry in 2019, the type we have in Australia, for example, we have the people that are allowed to work on the skin. You must have a qualification of a diploma of beauty at the minimum to actually provide skin treatments and facial treatments. I do believe there are some certificate courses which allow this, but essentially that's the minimum requirement specifically in the beauty industry, and this is a diploma level. We also have dermal clinicians, and this is a university degree where you go and you study and become a dermal therapist. We also have dermatologists which work on the pathophysiology of the skin. So they are actually doctors, and they undertake, their medical degree, and then they specialize in dermatology. And other than that, we really don't have any other qualifications for therapists working on the skin. So what I am noticing here is, and sorry, I'm not smoking or in a shisha place. It's actually my diffuser. That's what those little, it's the diffuser. So essentially the way I look at it, I'm trying to look from the university's perspective, and not just the universities, but the government's perspective. Because at the moment, a majority of the people performing skin treatments are diploma level graduates. Now, I'm not saying that a diploma level is not good enough. I'm not saying that whatsoever. That's my qualification. But a diploma degree will only give you a certain amount of knowledge, and in a diploma, well, at least from my experience, there was no reference to scientific journal articles and that type of thinking, which is called I've forgotten the name now. It's basically thinking, like looking for evidence-based practices based on evidence, and what is the word, objective thinking. I've forgotten now, but it's essentially the skill of looking at information and realizing what is true or false or biased. So that type of thinking just isn't prevalent in the industry right now as diploma. Individuals might think this way, and I really, really do encourage you to do that by looking at your sources and really thinking about where you get your information from, but it's not taught in a diploma level. And then the next levels up are really dermal clinicians and dermatologists. Now, according to from the government's perspective, I'm just gonna rearrange because my feet are hurting from a long day. So if you really think about it from the government's perspective, at the moment, we are allowed to provide skin treatments, but the thing is, we are providing a treatment to the body's largest organ, and currently at the moment, pretty much all industries that work with the body, so we're talking nurses, we're talking physiotherapists, myotherapists, all kind of naturopaths, all working within the body systems, they all have a minimum of a essentially a university degree where they undertake critical thinking was the word I was looking for before, where they understand critical thinking and they have a really in-depth amount of knowledge on the human anatomy and physiology. And it's a certain level of understanding and certification, you could say. Of course, as a beauty therapist with a diploma, you can undertake this study on your own accord, but that doesn't mean that you're going to be recognized as having that level of knowledge. You only have a diploma. So, where am I going with all of this? Well, essentially, the skin it's a huge organ, and what we do to the skin, including things like microdermabrasion, peels, even just gentle facials, every time you introduce an ingredient to the skin, you are essentially changing the way the cells behave. Whether you use a Vaseline or if you use an active ingredient like retinol, you are still affecting the way the skin cells behave, no matter what. So essentially, you are affecting the body's largest organ. You're working with a body system, an organ. So with all of that being said, it really makes me wonder, what's happening here is we're now getting dermal clinicians where they're getting this extra level of university study. And I guess my concern is that if we don't up level as beauty therapists, providing skin therapy services, we have the potential to lose the privilege of working on the skin. Look at America, for example. I'm not trying to scare anyone either, guys, but this is just generally my opinion. If you look at America, we have a really interesting thing happening when it comes to dermatologists. So dermatologists traditionally really only work with the pharmacology. So they diagnose a disease and then they prescribe a pharmaceutical for that disease, being a topical cream or some sort of medication. But now in America, you're seeing it's almost a standard for doctors to be prescribing skincare and then having clinicians underneath of them perform these skin treatments. So in America, it's kind of like the standard. Go see a dermatologist and they'll work out your skin conditions like acne and rosacea. Whereas in Australia, our dermatology isn't really like that. There are definitely dermatologists that treat like that, but there isn't as much. And from a public perspective, who would you trust? Somebody who is a beauty therapist and has all those negative connotations around being a beauty therapist. What do they know? And by all means, I have such a high respect for beauty therapists and everything we do, don't get me wrong, but that's sometimes a public perceived opinion. Whereas we have a dermatologist who is a trusted medical practitioner who is well known and has to undertake many years of study. When you compare the two as a consumer, you would go for the higher trust. Perhaps the cost is higher, yeah, for sure, but when it comes to your skin, your organ of the body, perhaps you might go to choose a dermatologist and you might only see a beauty therapist for more of a luxury feel. Now, with all that being said, my concern with the industry and the future of the industry is that as time goes by and the government starts to realize the overwhelming amount of evidence and the advances in skin and our understanding of the skin, is that they're going to realize what a huge risk it potentially is that we have beauty therapists treating the skin with only this much skin and anatomy knowledge. I'm sure it wouldn't be that hard of a thing to actually hand over all of these, the ability to work with the skin over to a dermal therapist, which they have already implemented. It's a highly regarded line to go down. And another point to really touch on is that at the moment, the way I treat the skin is through corneotherapy. It's a methodology and it was based on science, started in the 1960s, and essentially it's treating the skin in a non-ablative way. That's a simple way to put it. There's so much more to it. The thing is, dermatologists are practicing corneotherapy all over the world. You know, we're so lucky as beauty therapists that we can literally change the way an organ is expressed on the body. Like it's full on. Like we're not just dabbling around putting skincare products onto everyone willy-nilly and it's like, oh, it's fine, it's just a luxury. Well, no, there are actually really serious implications. Think all of those laser burns you've heard about, all of those terrible lost my train of thought. There are so many cases that you could look up when it comes to peels and IPL and laser burns and things of this nature. There are so many out there due to incompetence or a lack of training. Just think about this for an example. So in aged care facilities, when a patient, a resident I should say, has long toenails, no one in the residence, in the facility can actually cut the nails unless they have done a separate course that actually teaches them the health and the care around cutting a nail. Now, I'm not just talking about cutting a nail, the skill of cutting a nail. It's nothing to do with that. It's more so talking about the risks that can come from accidentally hurting essentially a resident with slow healing rates because of diabetes and things of that nature. So not even a resident, like a nurse, can just go and cut nails. But here we have, in the everyday population, we have beauty therapists and untrained nail technicians out there providing these services unregulated. I truly do believe that the industry needs to be more regulated, and as time goes by, things will be really, the government's going to come down on this. We're working with the body's largest organ after all. And, just a little food for thought. And like I said, please don't get me the wrong way, but we have makeup artists and we have, certificate trained therapists out there who maybe specialize in lashes and brows, and I love these girls. I absolutely love them. Not saying there's anything wrong with them, but I see them getting trained in specific skin techniques like microblading, for example, not microblading, dermaplaning. And I understand there is a separate course for this, and you learn about the skin and you learn about how the skin functions and what you're actually doing. But the thing is, you're literally putting a scalpel to the skin and you're breaking down the skin's first line of defense. That's a very full-on thing to be doing, and the industry right now allows certificate for, or I don't know the exact stats here, but people who are just trained in brows and things like this to be performing these services. Now, I'm sure there's amazing therapists out there doing it, but if you're using a scalpel on the skin to literally take off the skin's first line of defense, you're breaking down the microflora, you're imbalancing. This actually causes a pretty big threat to your health. You can cause all kinds of infections on the skin just by doing the wrong protocols. But even if you're doing the right protocols, that imbalance in the skin can cause issues like bacteria and things like that. And it has happened, and I've seen it before. So, it's just a bit of food for thought, and realizing that we have a huge responsibility to provide such a good service to people. We should really think of treating our clients in the skincare realm as an absolute luxury. Like, I'm worried that there'll be in the future so many cases of misconduct or negligence that the government just goes, look, we're just going to hand this over to dermal therapists. And I mean, when in history has this been done? I can't think of anything right now. I'd have to do a little bit more research to really consolidate these thoughts, but it's just something worth thinking about, and it should be a nudge to you as a skin therapist, if you are watching, to consider looking into journal articles, getting upskilled, understanding the skin science back to front, exactly what all the cells are, what are they doing, cosmetic technology, and exactly how ingredients affect the skin, and not just an ingredient properties. That's not good enough. An ingredient properties, really, it's like, oh, these are the benefits, but the thing is, you need to understand diagnosing of the skin and actually treating the skin and understanding how the skin functions and all of that, and reading articles, peer-reviewed articles, and treating in an evidence-based way. This is why I love corneotherapy. But yeah, those are my thoughts. Please, let's hope that the government doesn't take skin therapy away from us in the future, but I do worry if we don't up our standard, perhaps that may happen. So hey, maybe this doesn't happen after all, and I'm just theorizing something, but these are my thoughts, and I thought you might find it interesting. And if anything, it's just a reminder to upskill, consider what you are learning from and the source that you're learning it from, and just question everything and base as much as you can on the science, because that's what you're taught when you go to university, is that critical thinking. And looks like I'm in a shisha lounge. It's the essential oil diffuser again. It's just about critical thinking essentially. So I hope you enjoyed this talk. It's more of a personal opinion, like I said, but something to think about. Anyways, I really enjoyed being here with you, and I look forward to coming on board and talking about more skin educations or beauty therapist education topics. Have a lovely night, everyone, and I'll see you this time next week. Bye.